Hello, good evening, friends. I have heard of many people who suffer from what's called as an epileptic convulsion. Epilepsy. Convulsions can be of two types. One, which is idiopathic in nature, wherein there is no absolutely causative factor whatsoever at all. In contrast to it, we have what's called as symptomatic epilepsy. It is a manifestation, the epileptic convulsion is a manifestation of some other brain disorder or some other disorder in the brain. It's also called as symptomatic epilepsy. What are the causes? Traumatic epilepsy, head injury, especially psychiatrists say alcoholics, wherein the alcoholics are brought to the psychiatrist consultation room with abnormal behavior, and once he is admitted, on the second or third day, he can throw an epileptic fit. When an MRI brain scan is done, it shows a subdural hematoma. Alcoholics are notorious to sustain head injuries because of the intoxication. We have had one patient who was brought with alcoholic problems, but there was a history of for 10 years ago, and now he threw a convulsion in the hospital. Subdural hematoma was there, it was drained by the neurosurgeon. Focal cortical atrophy, it can cause a secondary manifestation of convulsion. Traumatic epilepsy, subdural hematoma, I told you. Cerebral diplegia, infantile hemiplegia can be a causative factor for secondary convulsions. Congenital AV malformations, I'm sure neurologists and neurosurgeons would have seen such cases in abundance. Dementias, be it presenile dementia or senile dementia, Alzheimer's, fixed disease, Jakob-Creutzfeldt disease, all can manifest with one convulsion only. Be cautious about it. What about the inflammatory conditions? More often than not, our general physicians see acute encephalitis, acute meningitis presenting with secondary convulsions. Cerebral vascular syphilis, of course, now it is a decline. But when we are doing MD in KM in 1977 to 1980, we used to see lots and lots of cases of neurosyphilis presenting with what? Presenting with cognitive impairment, delirium, dementia, and convulsions. Cerebral abscess. In one of the previous videos I had told, let the first be there in the brain, the answer is inside the brain. Similarly, cerebral abscess can present with a secondary epileptic convulsion. The answer I have told you, the solution. Cerebral cystic sarcosis, my friends. I can't resist my temptation to quote the example of the classical legendary tennis player Leander Pace. What happened to him? He went to US, wanted to play a match with blindfolded. He threw a convulsion, couldn't play the match at all. He was shifted back to India. What did he have? He had cerebral cystic sarcosis. He had a convulsion then also. Then cerebral malaria can present with convulsion. Intracranial neoplasms, I need not emphasize on this. Stokes-Adams syndrome, such problems can also present with secondary, convulsion. Alcoholism. Psychiatrists, neurologists come across alcoholic problems. Either alcoholic intoxication per se or alcohol withdrawal syndrome. Delirium tremens can present with alcohol withdrawal convulsions. What are they called as? They are called as rum fits. Withdrawal syndrome convulsions are called as rum fits. Drugs, what drugs? Amphetamines, cocaine, LSD, all can produce convulsions. Asphyxia, due to any cause, my friends, can produce a secondary convulsion. Metabolic disorders, hyponatremia, hepatic encephalopathy, so many metabolic causative factors can produce secondary, convulsive disorder. Industrial poisoning. More often than not, we miss it. Which metals, lead, plumbism, solvents, strychnine poisoning, it can produce a secondary convulsion. Arsenic, thallium also, not to forget, insecticides, organophosphates can produce secondary convulsions. Vitamin B6 deficiency, my friends. Not many of us think of this causative factor, but vitamin B6 deficiency can cause a secondary convulsion. Last but not the least, food poisoning. Apart from it producing nausea, vomiting, diarrhea, GI disturbances, it can present with only a solitary convulsion. These are some of the causative factors of secondary epilepsy or symptomatic epilepsy. Coma from any cause, it can present with a secondary convulsion. Thanks a lot for watching the video. Please do share it and like it. All the best. Thank you. God bless you.